Hello and a warm welcome to Roundtable. Denmark has become the first European country to launch a fourth COVID booster drive, following Israel and Chile. But the European Union's medicines regulator has warned that repeated shots could compromise the immune system. Well, even Pfizer's chief executive says he isn't sure if a fourth dose is needed, so who will benefit from such a jab? And is it justifiable when almost half of all people worldwide haven't even had one shot? Very good to have your company. I'm David Foster. Well, earlier this month, Israel became the first nation to start administering a second booster or fourth shot to those over 60. Denmark is doing the same. The World Health Organization, however, says repeated booster doses are not sustainable long term, while the drugs company Pfizer claims it will have an Omicron-specific vaccine ready by the end of March. Initial findings from an Israeli study show its claim that the fourth dose boosts antibodies five-fold in the week after it's taken. UK experts say the protection against hospitalization stays at 90% 3 months after a third dose. Well, while rich nations ponder a fourth booster, 49% of the world have yet to receive their first jab. Okay, so no scientific brains on the round table team. Let's bring some in. We go to Jerusalem and we say hello to Zvika, Granot, Professor of Immunology at the Hebrew University of Jerusalem. He'll be critically looking at his country's rollout of the fourth shot. To London, and there we see Professor Jeremy Brown from UCL, that's University College London, who's a member of the UK's Joint Committee on Vaccination and Immunisation. And we welcome back out of Bath Dr. Bharat Pankania, Senior Clinical Lecturer at the University of Exeter Medical School. Let's go to Jerusalem. Zvika, I gather you've got COVID at the moment. How are you feeling?
So I'm feeling perfect. You know that some of the people who contract COVID are asymptomatic, so I'm happy to be one of those. Unfortunately, this is not shared by everyone who gets infected, and this is why we're facing this dilemmas at the moment. But personally, I just feel fine.
And you've had two vaccinations. You haven't even had the third, let alone even been offered the fourth.
Right. So in Israel, they started giving out the booster shot several months ago. When they did that, it was before it got approved by the FDA. And in Israel, we follow the FDA guidelines. So I felt it was probably not tested sufficiently for me to really take it. And then as time went by, it was approved, and it seemed like the booster shot is, in fact, safe. But still, I didn't get a feeling that it was necessary and really providing more protection than the initial two shots. So that was my personal decision not to take the booster shot.
So why has your government decided it is the right thing to do? And did they listen at all to people like you who don't think it's necessary at this moment?
So the truth is that no, they just have the same group of advisors that have been running this crisis for the past 2 years. In Israel, there's one opinion. They do not listen to other opinions. There's this consent within a group of 80 people that sit in these committees and advise the government. And I don't know how and why and what is the sequence of events that leads to these approval of the first booster shot, the third shot, and then the second booster shot. This is all. It all raises a lot of questions that, for some reason, the public in Israel don't get answers to.
Jeremy, you sit on the same sort of committee, the JCVI, that would be advising the British government, as we've just heard described by Zvika, but not perhaps as dogmatic in its approach. How open is the British government to deciding whether or not to follow the scientists' advice?
What the JCVI do is it provides advice to the government, and the government decides on whether they follow it or not. And I'm not party to that second part, the decision-making process about following the advice, but essentially they followed all our advice, the only exception being that when we came to the decision about vaccinating 12 to 15-year-olds, we'd said that there's no strong medical need for that. And the chief medical officers, not the government, suggested that actually the need for the vaccination in that age group was related to their preventing disruption in their education, which is perfectly reasonable, but that was the only thing that's happened, which is outside of the JCVI's specific advice. And that was because we weren't really constituted to decide on whether the vaccine would help or would have a positive benefit on education or not.
It was only just before I came on air that we found out that Denmark had followed Israel and Chile in recommending a fourth dose. Why do you think it isn't necessary at the moment, Jeremy?
So we did agree on an extra dose, a third dose, where that was decided on in around September, and the policy was instigated and in fact speeded up in the face of the Omicron surge that we've had over December. And that's actually been incredibly beneficial. We think that's saved an awful lot of admissions to hospital by reducing the sort of surge of Omicron infections that has just struck the country enough to reduce the hospital admissions. Now, we were considering a fourth dose as an extra dose to actually try and combat Omicron for the most susceptible people, the very elderly and those underlying diseases. But we decided there's no need for that at the moment because the third dose seems to, the protection against severe infection, the infection that causes you to come into hospital, seems to be sustained enough from that third dose for the months that we have after that third dose, which covers this Omicron period. So that a fourth dose is not needed at this moment in time. Now, what we really need to see is what happens to the protective efficacy against hospitalization with the COVID virus several months after that third dose, 6 months or more, because that will dictate what the need for a fourth dose in the vulnerable population will be going forward.
Can we go back a stage? We're talking about fourth dose, but let's go back to doses 1 and 2 when it comes to Omicron. Would that, do you think, have been sufficient to protect the population from the most serious effects of this new variant of coronavirus? Or was that third shot absolutely vital? In other words, has Omicron's nastiness been overblown, perhaps?
The third dose was necessary because we saw the vaccine efficacy of 2 doses. We have data for this for the UK. Against Omicron was poorer than after a third dose. So that increases the prevention of hospitalization by 20 or 30%, that third dose, which is very useful.
Okay, we will come back and talk about vaccine fatigue in a little while, but Bharat, I want to bring you in just now. But first, I want to hear from the head of the WHO, that's Dr. Tedros Ghebreyesus.
In low-income countries, most of which are in Africa, less than 2% of the adults are fully vaccinated, compared to with almost 50% in high-income countries. Some countries are now rolling out booster doses to fully vaccinated people, when millions of people around the world have not even received their first dose. That's why I have called for a moratorium on boosters, at least until the end of this month. But for now, we do not want to see widespread use of boosters for healthy people who are fully vaccinated.
So he was saying that last week. He says we need to stop giving these boosters now. Bharat, A, do you think that's a good idea? And secondly, is it likely?
Looking at it from a population perspective, the WHO is absolutely right. So my other 2 colleagues have given their answers based on the brief that they were given. Now, if my brief is global health and population globally, then I will say the following. Unless and until you suppress infections globally, you will continue to want to only shield yourself, because that large shower of virus particles keeps on coming from the or under-immunized parts of the world, and you keep on having the potential to create variants of concern. Therefore, if you were to really take a pragmatic global approach, what you do is simultaneously immunize the at-risk people, healthcare workers globally, and that way you bring down globally the virus in circulation. And when you reduce the thunderstorm of viral particles to a small trickle of a light shower, or a drizzle, you know you are better protected with a drizzle compared to a thunderstorm of virus particles, to use that analogy. So for global health, what we have to do is, sure, you immunize your population. Having done that with the priming doses, maybe 2 or 3, you've got to move on and enable the rest of the world to be immunized, which it hasn't been thus far.
In effect, are you suggesting that at the moment those people or those countries that are giving the 4th booster and those that are contemplating the idea of doing so are putting themselves in a bunker and hoping that the storm that you've just talked about will pass, when it is unlikely to do so because there's so much of it still to come?
Yes, I am saying that, and also we are in a mess. And let me explain why I say we are in a mess, which is we've entered bunker mentality, which means we are asynchronous. We are not in synchrony with the rest of the world, which has not been immunized. So our immunity is generated, our immunity drops, we take a booster. Immunity is boosted up, and then the immunity drops again, we have to take another booster, and so on and so forth. What would be much better is, sure, politically, you immunize your population to a level. Thereafter, it is in your own self-interest to immunize the rest of the world so that that storm, that shower, those variants of concerns don't keep on coming your way. That is a much better way than to say that bunker mentality of, I will periodically have to keep on boosting my immunity via boosters.
So why are we in this position? We've been talking about vaccine inequality on this program for the best part of 18 months, if not a little bit longer. Why has nothing changed internationally? Bharat, I'll ask you that one as well, and then we'll go around the panel again.
So there are several reasons here, and we are led by a perfect storm of politicians. President Trump, to begin with, in America, Bolsonaro in Brazil. We've had populism here in the United Kingdom with Prime Minister Johnson, and all of these leaders have been populists. They want to show that they are doing great for their country, and they forget the bigger, the global picture, which is you do good here and you start doing good there too. With the arrival of President Joe Biden, he changed the intellectual property rights and patent protection and said very clearly, for the pandemic, we need to relax these restrictions and enable technology transfer, manufacture of vaccines locally in other regions of the world, and use those vaccines. Unfortunately, United Kingdom, European Union, Australia, and 1 or 2 other countries objected to this because they want to keep that intellectual money-making process in their pockets with respect to vaccine manufacture. And then we enter this bunker mentality of constant boosters whilst Africa and other parts of the world remain unimmunized, and they can carry on generating variants of concern for the world to keep on taking a step backwards.
So it is a moral argument about people being selfish and governments wanting to protect themselves against anger of populations. I get that. What about the practical side of things? The head of the European Union's Medicines Agency has said that repeated boosters could compromise the immune system. Marco Cavalieri saying this also, while use of additional boosters can be part of contingency plans, repeated vaccinations within short intervals would not represent a sustainable long-term strategy. Zvika, it can compromise the immune system, it is suggested, and there's also the suggestion of vaccine fatigue. The more you ask people to do these things, the less likely they are to be interested.
Right. So in Israel, you can see that compliance is going down with every booster shot that is being offered. And just a word of caution regarding the repeated boosters. The human body is a very efficient machine. And as you give more and more boosters, your immune system becomes really good at identifying that specific thing that you've been immunized against. Meaning that if you encounter this, you'll be fine. But small changes like small variations or small mutations that the viruses accumulate with time will now render you more susceptible, even though you got all these shots. And I think what my colleague just said about how the pandemic is being managed, we see that it's not always medical concern that is leading the strategy. And I think it's a poetic justice, in a sense, that the Omicron variant originated from Africa, which is the least vaccinated continent worldwide. So you see, we take care of ourselves. Our countries give us more and more booster shots, and vaccines are available to anyone who needs them. But we neglect other parts of the world, and then we have to pay the price for this.
Is it time to give the World Health Organization more powers to allow it to be able to instruct countries where to send vaccines rather than allow them to choose themselves? Because right now, the WHO, as I understand it, has very little actual power.
Right. I don't think governments are going to give up this power, and big pharma companies are not going to give up this power. They invested a lot of money in developing these vaccines. These vaccines apparently have some benefits. They sell them for a high price, and they will not give it up just for free. Again, if this was managed from a medical perspective, then yes, you would want to have everyone vaccinated or have drugs to treat coronavirus infection available for anyone. We want everyone to have a good, safe life and be healthy. But that is not the case. And you can see that not only in this COVID pandemic, you see that with other diseases. Look at HIV. You don't die from HIV in the first world. Third world countries, if you contract HIV, you will die from it, even though there is medication to treat you.
Jeremy, what about Pfizer, the big drug company? Yeah, please.
I just wanted to say, whilst the pharmaceutical companies may have invested a lot of their money in inventing the vaccines, we must not let them off the hook. One, they were funded by public money to allow them to invent the vaccines. The second thing is they also have a duty of care and responsibility. We are not even telling them not to make enough profits. We are telling them to not sell up all their forward orders to the Western nations, which have already had their second, third, and fourth vaccines. We are asking them, come on, be reasonable and keep aside vaccines for the poorer nations to also buy from you. And remember, we funded you with public money to invent your vaccines.
Okay, get it, Bharat. Jeremy, I was going to throw to you on the idea of a specific variant vaccine, which Pfizer says it's working on with Omicron. I'll come back to you on that in just a moment, but a chance for you to respond to what you've heard in the last 5 or 6 minutes.
Yeah, okay. So, I fully agree that vaccinating the rest of the world is very important, and it would be great if that could happen. I'm not going to discuss the reasons why that's not happening. It's not really an area of my expertise. But I'm afraid there's a lesson that we take from the Omicron variant, which is that arose, or at least it was amplified in South Africa, where they have had enough vaccine to vaccinate their population, yet 25% of the population only have been vaccinated. What that means is that even if there is a lot of vaccine, the vaccine hesitancy or the slowness in delivery of the vaccinations means that there's still going to be an awful lot of variants coming our way from the rest of the world. And therefore, as a person who's considering what's good for the British population, I need to be aware of that. And that does mean that we need to expect additional variants that may come to us, like the Omicron's just come, and therefore we need to make sure that our population's protection against severe infection, and I don't mind about mild asymptomatic infection at all, but severe infection I really do mind about, that level of protection is maintained in some way, and that will potentially require booster vaccinations, although it's not clear yet exactly what that will be necessary for that in the future.
Okay, so Pfizer says it's developing or working on at least a vaccination for the Omicron variant. We've had the Alpha, the Beta, the Delta, the Omicron. There may be others that I'm not aware of. But are we going to end up in a situation, this is for you, Jeremy, and anybody else can come in, a situation very long before we realize that this is what is needed, rather like with the flu vaccine. Every winter it changes, every winter a new type of vaccination, a slightly engineered version of the previous one, but different where it needs to be, has to be developed. And that's what we're going to have to see in the years to come.
Yeah, I mean, yes, sort of, but it's actually a bit more difficult and complex. Flu, we're lucky in the Northern Hemisphere because the Southern Hemisphere get their flu virus before us, so we can see what's happening in Australia and plan for the variants that might be reaching our shores a few months later and vaccinate against those specific variants. Can't do that with Omicron. I think it goes around the world too quickly, and there's no sort of regular pattern that being established yet of where a variant arises from and spreads from and the speed of that. So that will not be possible to be ahead of the variant by seeing where it's coming from and getting a vaccine ready in time before it arrives in the UK or whichever country you're vaccinating. So that isn't going to work. I think we're going to have to be more intelligent there, and I suspect what we'll end up with is what we call as a multivalent vaccine, where you have different versions of the spike protein within one vaccine, which cover the different potential possibilities and the sort of range of different variants that could arise or might be out there. Something along those lines will be very beneficial. Something that gives broader immunity than the existing specific, very single protein vaccines that we have at the moment.
Does that mean people in the Southern Hemisphere can never protect themselves against a particular flu virus? Just a quickie, Jeremy.
Yeah, no, it's a good question, because if we get it in the Northern Hemisphere after the Southern Hemisphere, what do the Southern Hemisphere do about planning for their flu vaccination? I don't know the answer to that. I should do, David. I just don't know. They do have a vaccine program, and they must decide on some methodology, but I don't know how they do that.
You go away and find out, and we'll invite you back on another program when we get a bout of flu coming around in this country. I'm sorry to interrupt. Who was it, Barad?
No. The Southern Hemisphere for influenza do exactly what we do in the Northern Hemisphere for influenza. In other words, if there is something curious in circulation in the Northern Hemisphere, that is the vaccines that they're going to make for the Southern Hemisphere's winter when it comes. So the cycle is repeated between the South and the North. What we do in the North follows what's happening in the South. What's happening in the South, we follow what's happening in the North, the other way around.
Okay, Zvika, was it you that wanted to jump in?
Yeah, I just wanted to comment something about what Jeremy just said about compliance. So apparently in South Africa, the vaccines were available, but only 25% of the population decided to get vaccinated, or the vaccines were available for. I just want to give Israel as an example. There is an issue of compliance. When the vaccines were just available, Israel is a small country, about 7 million people got vaccinated. That was the first shot. Second shot, there were about 6 million people. Third, the booster shot, only 4 million people. And if I have to guess, then the fourth shot will be around 2 million people. Just because people get fed up with injecting themselves with more and more booster shots. And when you look at the flu, so the vaccines are available every year, but you never reach percentages as high as 70% immunization, just because people don't really see the necessity. So not only that we need to get better vaccine or long-acting vaccines or more relevant vaccines, there's also an issue of compliance, and I foresee that people are less and less eager to get vaccinated, and as this gets longer and longer, less and less people will run over and get the vaccines.
Let's go back to something that I mentioned early on in the program, what the head of the WHO, Dr. Ghebreyesus, had said. He called for governments to have a moratorium, in other words, a temporary halt to the fourth booster, or the second booster, the fourth jab, until at least the end of this month, that is January. In Israel, is that at all possible, that the government will listen to what the head of the world's regulatory medicines agency says?
Absolutely not. There is the way this pandemic is being managed in Israel is out of panic, at least in my view. And now that we see that the Omicron variant is swiping Israel and the numbers of people getting infected are staggering, really. We see that people that were immunized twice, got the booster shot, are also susceptible, and the Omicron infects these people with an efficiency that seems to be as high as infecting those that were never vaccinated at all. Now, the government in Israel doesn't have a lot to offer. What they can offer is more of the same thing. It's another booster shot. Now, I have to emphasize that this booster shot is the same vaccine that was designed against the Alpha variant, which is a year old and is completely irrelevant at this point.
If I may, because we're coming to the very end of the program, and thank you also to you, Jeremy, and to you, Barat. But Zvika, just to end, because Israel has what started us on along this lines. Do you believe your government's listening to scientists or to economists?
I think my government is run by politicians, and they're very much concerned about their political livelihood. There are medical issues and there are economical issues, and it seems to me that the balance always tilts towards the political benefits of the members of parliament and the prime minister.
Okay. Well, listen, I want to say thank you very much indeed to all three of you, to you, Bharat, and to you, Jeremy. Zvika, I want to say get well soon, since you've been suffering from COVID, and also the same message from us to your son, who I think you caught it from in the first place. So whether you have 1, 2, 3, 4 or no vaccinations, we hope you, wherever you are watching this program, also manage to stay safe. From me, David Foster, and the Roundtable team, goodbye for now.